Pericardiocentesis used to be a blind, high-risk procedure until now. In this video, Rob Reardon, co-author of Ma and Mateer's Emergency Ultrasound, breaks down a modern ultrasound-guided approach that makes this life-saving procedure safer, faster, and far more precise. Let's get into it.
Pericardiocentesis used to be something that we thought was a difficult procedure and people were hesitant to do it. But really with this modern approach, you'll see that it's pretty easy. It's similar to putting in an IV. If you have a linear probe and you've put in an IV before, you can do this. We used to do this blindly, which is kind of ridiculous. We'd stick the needle in the subcostal area and kind of aim for where we thought the heart was, and that brings you through the liver. So you put the long needle through the liver and pray that it got into the pericardial space. This was a risky procedure and usually unsuccessful. So the old blind method, we would go through the liver. You can see where you would go by doing a subcostal view if you want, but that you're always going to be looking through the liver, and that's where your needle is going to go. That's the worst place to go. The other option, and this is what we did for years, is we would go out to the lateral chest. The image on the right there is probably the best, and then we would get an apical view of the heart and the effusion, and then we would put the needle just medial to the probe and kind of aim it in a direction that we thought wasn't going to hit the heart and was just going to go to the effusion. And that works pretty well, but it's still a little scary because you can't see the needle path very well with the cardiac probe. So here's the modern way. First of all, your needle is going to be going pretty close to the sternum in a medial to lateral direction. So you want to look at the internal thoracic or internal mammary artery. In this view, the probe is placed across the chest, like this, okay, in a transverse method. So you're seeing the edge of the sternum here, and then you're seeing the heartbeat here underneath it, but right off about 1 centimeter from the edge of the sternum, or a 0.5 centimeter from the edge of the sternum, is this artery that you don't want to hit. So usually you can go out lateral to that and start your needle path way out here. This is just an example of one that we did recently, is we were out in the lateral chest, far lateral to the internal mammary artery. And then you can see the needle path. This is a rib. You can see the needle path coming this way. You can see the effusion, which looks huge on this view. Your needle is going in plane with the linear probe, so you can see it really well where those arrows are. You'll see when I turn this back on, there's the needle again. Here's the tip puncturing into the pericardium. Pretty obvious and nowhere near the heart. And if you look at the direction that it's aiming not toward the heart. It's just into the pericardial effusion only. So at this trajectory, you can see it clearly and it's not going to hit the heart. As soon as you get fluid back, you put your wire in. Okay, here's the wire, or here's the needle again. There's the tip. Here's the wire coming in. Leaves this kind of characteristic shadow. And then here's the after effect. So the effusion's getting smaller, and we injected, the catheter is placed over the wire, and we injected some saline in to the pericardium, and you can see bubbles inside the pericardium. Just proves that the catheter is in the right place when it's done. And then here's where it was on this particular patient. So the sternum's way over here. Anywhere beyond or lateral to that internal mammary artery is fair game. All right, so that's the modern approach to ultrasound-guided pericardiocentesis, and you can have a low threshold to do this because it's an easy approach. If you can't see your needle, don't push it forward. That's the one rule, but if you can see your needle, you can be confident you're putting it in the right place.
Seeing this technique is one thing, but being able to do it yourself is another. If you want hands-on training in point-of-care ultrasound, HQ Med Ed is hosting a live course this May where you'll learn directly from experienced clinicians and practice these skills in real scenarios. Spots are limited, so head to hqmeded.com to learn more and sign up.